recording. Alright, liquid dosage forms can come in the form of solutions or dispersions. Solutions are defined as a solute dissolved into a solvent. They are single-phase systems, meaning that they are clear and homogeneous. Because a solute is dissolved at the molecular level, if you were to look at a solution under a microscope, you wouldn't be able to see the separate solute and solvent particles, and these particles are going to be less than 1 nanometer in size. Dispersions are two-phase systems split into two different categories, colloidal and coarse dispersions. For colloidal dispersions, the solute is dispersed in a solvent and its particles are going to be 1 to 500 nanometers in size. For example, blood. Blood has plasma plus the red and white blood cells dispersed in the plasma. For coarse dispersions, they are going to be either emulsions or suspensions. An emulsion is a liquid plus another liquid, and a suspension is going to be a solid plus a liquid. So about 20% of the drugs that are available are going to be in the form of solutions. They are the oldest dosage forms known. In a solution, the solvent should make up the largest percentage of the volume, so meaning the solvent is going to exceed the solute. Exceptions include solutions like simple syrup, USP. So this little chart just shows that there are a total of 9 different solute and solvent combinations that can be made with the 3 phases of matter, solid, liquid, and gas. So this is just traditional nomenclature of solutions. And here is the route of administrations. So oral is by mouth, topical is skin, otic is ear, ophthalmic is eye, and like she said, we're not going to really go through 6 through 8. Alright, so advantages of solutions. Solutions are really good for children and old people who have trouble swallowing. Also, solutions have a faster response rate than solid dosage forms, and this is because solutions are already in a dissolved state. Also, solutions are more uniform than suspensions. Just think about it, suspensions usually settle into two different parts after a while, which is why you have to shake them up. And solutions also reduce gastric irritation because they are absorbed faster, and so they stay in the stomach for less time. And of course, there are disadvantages to solutions. Solutions are bulky, and this becomes a problem during travel and storage. Some drugs also cannot be dissolved in some solvents. Solutions have a shorter shelf life than solid dosage forms because the solvent may act as a reactant. So for example, penicillin that is dissolved in water, the water eventually becomes a reactant after some time, and this reaction is called hydrolysis. Also, solutions enhance the bad taste of a drug, and they also require preservatives. So for the preparation of solutions, solutions are mainly produced by the simple solution method, the first one. This is where you take the solute plus a solvent and put it into a mechanical stirrer. Heat is sometimes used to speed up the process, but this is only seen in large industry type places, not common pharmacies. You can also prepare a solution by chemical reaction. This is where you react 2 or more solutes in a suitable solvent. So for example, aluminum subacetate solution is prepared by reacting aluminum sulfate solution with acetic acid and calcium carbonate. And then the third one, to prepare a solution by extraction, you would have to take some type of column packed with an oil from either a vegetable or an animal. Then after that, you would pass a solute through that column and then extract the active ingredient from that oil. Right, so types of oral solutions. For dry mixtures, they are a dry mix of ingredients that already have everything in it except for the solvent. So they have the active ingredient plus the excipient and flavorings and other things, and then you just have to add the solvent at the time of reconstitution. These dry powders are going to be available either in a powder form or granules for reconstitution. And once it's reconstituted, the solution will remain stable for 7 to 14 days. An example of this would be penicillin. Alright, so oral rehydration solutions are given to people to rehydrate a person who has lost fluids during GI distress. So an example of this would be diarrhea. When someone has diarrhea, not only are they losing electrolytes, they may become dehydrated and go into shock. A lot of the times diarrhea is caused by a virus or bacteria, so we want to flush out this virus or bacteria by continuing to have the diarrhea. So oral rehydration solutions fix the fluid loss problem, not the diarrhea problem. Oil rehydration solutions usually contain sodium, potassium, bicarbonate, glucose, and citrate. So when someone is having diarrhea, their intestines will absorb glucose. This is why there is glucose in these rehydration solutions. So when the intestines absorb glucose, it will in turn allow sodium to be absorbed because the glucose transporter also contains a channel for sodium to go into. The absorption of sodium would then trigger the absorption of water. Alright, so syrups. Syrups are concentrated aqueous preparations of sugar intended to mask the bitter taste of drugs. They contain preservatives such as sodium benzoate or methylparaben. Syrups can be either non-medicated or medicated. So non-medicated syrups such as simple syrup are 85% sugar, and they can also be a syrup with a flavoring added such as cherry or orange. And then the medicated syrups are obviously going to contain a drug. So for example, the guanfenicin is a cough syrup, and Benadryl is a syrup used for allergies. So sugars are traditionally sugar-based. They are usually containing 60 to 80% sucrose, but we also see sugar alcohols such as sorbitol and propylene glycol being used. Sugar in syrups increase the viscosity of the syrup, which also aids in masking the taste of the drug, because the more viscous the syrup, the less easily it will spread over the tongue, and so the more it will mask the taste of the drug. So for diabetic patients who cannot have sugar, well, sucrose, their syrup drugs contain saccharin and aspartame for the sweetening effect. And these sweeteners do not make the syrup viscous like normal sugar does, so we'll have to use methylene cellulose and hydroxyethyl cellulose to enhance the viscosity. So compared to concentrated syrups, dilute syrups will be prone to microbial growth. This is because sugar acts as a preservative after a certain concentration of sugar is reached, and that concentration is going to be 85%. So syrups with a high sugar content do not have the water available for microbial growth to occur, which is why the concentrated syrups we're going to see less microbial growth.